And could we start sharing the screen? But I need to inform you, and I need to let you know that I haven't done, and I'm not going to give you a presentation like the previous ones. I have not been searching in literature or in published work so that I can put to you nice phrases and tables of how other people have worked and how other patient organizations have actually contributed to meeting the expectations of the patients. I have formulated my thoughts in the last couple of hours in the course of my work in the TIF office, because I felt that I should be giving my own thoughts out of my experience and out of my knowledge and out of my contact and communication with patients, with you, first of all, and with patient organizations all over the world. So, through my 15 years of work, I have learned the hard way, and I have come to recognize the reality of the difference, the reality of the variability, complexity, and heterogeneity of the challenges and the needs of the patients, the different concerns faced by the patients all over the world, and hence the complexity and heterogeneity of their expectations through the work of their patient organizations. The dictionary defines expectation as the feeling that good things are going to happen, that there should be an expectation or thinking that something is going to happen, and that something should be an improvement to the existing situation. And the same goes for anticipation in the dictionary, a feeling of excitement about something that is going to happen in the near future for improvement. And this is what we are talking about, expectations of patients for improved health and improved quality of care. Patients are expecting to address their needs and their concerns, and there are many parameters to addressing their concerns, but today we'll only focus on how patient organizations can focus on addressing these expectations. But the expectations, as I said, how can one define this, or how can this be described? They are not a single set of parameters, but they vary mainly according to the challenges that the patients face and according to impedable factors like where the patient lives, how health and social care are provided to patients with thalassemia in the country, on the robustness and financial coverage provided by the health and social care system, on the Human Development Index of the country, on the priority given by the government to thalassemia and other hemoglobin or genetic diseases on the national health agenda, acknowledging the fact of other key health priorities of the country, including communicable diseases and common non-communicable diseases such as diabetes, cancer. Therefore, these are parameters that contribute to the challenges that patients are facing in a country, which are different and variable across. So how patients and families in the country respond to advocacy, this is also a very important factor, and this is also part of our presentation today. We know that there are parameters that we cannot change, we can try and change, but there is a parameter that we can change and strengthen. Strengthen how patients and families are advocating, the strength of advocacy, and how they convey these needs and expectations to the competent authorities. That, of course, requires knowledge and continuous updating and upgrading of the knowledge of the country itself, of all the parameters in the middle column. Why is it we're not changing? Okay. So considering that, More than 70% of the global thalassemia community lives in low, middle, and medium resource countries, and that an equal percentage of these countries do not have or are just in the process of developing healthcare systems based on central coordination and universal coverage, and do not include disease-specific national prevention and management programs. Considering facts that you know very well, more than 60% of these countries do not have a centrally coordinated national blood transfusion service, which is very important for the health and quality of life of our patients. And in more than 40%, their blood supplies do not rely on regular, voluntary, non-remunerated practices, affecting, of course, the safety and adequacy of blood. And in most of these countries, accurate and regular monitoring of iron and continuous flow of chelation drugs for effective chelation are lacking or suboptimally provided. And multidisciplinary care and expert consultation and work and service through reference centers are almost absent in the majority of these countries. So the patient organizations in most of these countries are weak, sadly, with no infrastructure, weak leadership, and hence have no real impact or positive influence on promoting disease-specific decisions and policies. In these countries, acknowledging all these realities, the patient community is facing challenges in obtaining basic medical and social care. Stigmatization and economic suffering, which often leads to financial catastrophe of the whole family. I am just underscoring once more the absence of universal coverage to justify why there can be economic suffering. Completing education is a challenge. Securing a place in employment are important and significant basic challenges faced by the patients. Therefore, their expectations, the expectations of these patients, are including addressing these challenges and these basic needs. Now, what and how can a patient organization address some of these expectations in these patient populations? Well, we are all aware and we feel it and we see it throughout the years and on an everyday basis of our lives, those who are involved with patient organizations, that getting patients together, discussing and interacting is a major first point, because patients and families start feeling a sense of belonging to a community. And what community? A community that understands, feels and shares the same challenges and expectations. So patient organization achieving to have an appropriate infrastructure and leadership can begin to develop the programs, the essential programs, to keep patients aware, to keep patients educated, and starting through these to gain the reliability, confidence, and trust among its members. These are very important elements, reliability and confidence, because these are what are going to bring the patient organizations nearer to the competent authorities, whether health, social, or other competent authorities. The authorities then, only then, can become more inclined to grant an ear and devote time, even if this time is limited, to listen to the concerns and challenges. So the role of the patient organization in these countries, facing all these challenges that we have just gone through, should be focused first and above all on addressing basic needs and expectations, to work first and above all to secure free of charge health and social services for their patients, to work with transfusion services to strengthen the donation adequacy and safety of the blood, and to work closely with the competent authorities to make competent authorities recognize the value of implementing effective management services, both for the quality, the health and the quality of life of their patients, but also for the cost effectiveness of their own healthcare services within the government. On the other hand, developing meaningful networks and productive collaborations with stronger associations, either within a country or outside the country, is of huge, immense importance, because sharing best practices empowers patients and parents to come together to strengthen the work of the patient organization in order to fight and meet more successfully their expectations. Now, I've tried to divide the challenges, needs, and expectations. It's very difficult, as you know, because it's a complex situation across the world. But grossly, we can divide the patients into those I've been talking about until now, in the low and low medium income countries, where basic needs are still fought for. And the second group, patients in the medium and high resource countries, where of course less than 30%, even less than 20% of the global patient community lives. Now, these patients may face similar challenges and may have similar expectations to those described for the low and low middle income countries, but perhaps to a different extent, to a lesser extent, in a different way and for different reasons. In some patient populations in these countries, rarity of the disease may be the contributing factor for challenges and needs. In other patient populations, challenges may be just consequent to the absence of political decision on prioritizing genetic diseases on the whole, on the national health agenda. In still others, quality services and expert services are concentrated only in the central areas. So challenges in these patient populations are mainly in relation to accessing specialized medical and other healthcare professionals' care, multidisciplinary and reference center services. These patients can fight, but their fight may be easier because patient organizations can be supported and can do so in an easier way, because in these countries there is already robust health and social care infrastructure. With the exception of the United States, almost all the other countries are based on universal health coverage. There are nationally coordinated transfusion services. There is abundant expertise and knowledge to establish multidisciplinary care and reference centers. Therefore, although patient organizations may face similar challenges, and patients themselves in many countries may face similar challenges as the ones in the low-income countries, their role and the work of the patient organizations is facilitated by the existence of better and of more robust healthcare infrastructures, and very importantly, those that are related to the disease, including transfusion services and universal coverage. But why we cannot change it? I need to change whenever. So, in every case, however, and I am finishing up this, every patient organization, wherever it has its legal basis, must follow up and regularly update its members on research, on scientific advances, and prepare themselves for improvements, however, without raising expectations that cannot be met in the short or medium term. Collaborations and networking with the academia and pharmaceutical industry should remain part of the work and activities of every patient organizations. But it is very important to realize that meeting expectations is not a set of similar parameters in every region or even in every country within each region. But irrespective of the challenges we are fighting for, and perhaps the basic needs for which we need to cover in the majority of our patient, where our patient global community lives, we need to keep our patients educated and updated, because we provide hope, we provide expectations that we need to be very careful on where to stop as patient organizations. The role of a patient organization is first and above all to share experiences, to bring patients together and identify those needs, those basic needs, so that the patients can be healthy, can have a quality of life, can have social inclusion, and of course, all other activities that bring them to the center of focus of a competent health authority. Advocacy and activities of the patient organizations. The Thalassemia International Federation has made every effort to succeed. It's not a national patient organization, it's an umbrella embracing the rights of patients in every national organization. And what we felt through the years that it was necessary to promote, to support the national patient organizations' work were these 5 pillars of activities, most importantly, the education, the upgrading and the continuous updating of the educational program, the networking, very important, collaborations with national disease-specific associations, but also with health authorities, relevant professional medical bodies to support our work. The understanding of what policy advocacy is and how patients can advocate, how patients can speak about their disease, how patients can speak as equal partners with their government. And this can only be achieved if patient organizations work in a way to provide appropriate education, and so their patients can feel they can rely on the work of the patient organization. And realizing through our global Thalassemia Review 2021 that there are unmet needs in more than 80% of the countries, many complex and different in each region and in each country, one can very well understand that the challenges are different and hence the expectations are different. I got a message yesterday from Nepal that a patient was desperately trying to find 1 unit of blood, even unfiltered, even on screen, because his hemoglobin was 5.2. So this is only an example of the many that are around us. And when we speak of challenges and expectations, when we speak of expectations, we really must think of the challenges first that the patients are meeting. So unmet needs are many, multiple, they're universal across the globe. And what we usually say here at TIFF, very subtly, there are huge inequalities in the provision of appropriate and quality care. That's all from me. And of course, this is what I gathered through my work at TIFF. I have not opened research channels to find out how a patient organization can support, because I've been working day and night for 15 years in this federation. And I know that there is not a single set of rules of how a patient organization can address the expectations of patients, because those expectations are based on challenges. And those challenges and needs are variable, complex, and different in each country, in each region, across the world. Thank you.